Okay. Well, thank you, number one, for being here, Tracey. This is a conversation that I've been looking forward to for quite a few weeks now. Number one, because I feel like I haven't seen you in forever, but also I think that I know you have a huge footprint in regards to why VICTRESS exists today. And I don't know how many people really know that. And I'm excited to dive into that conversation. You being a mentor of mine early on has left a lasting impact on me, and I'm just forever grateful for that. Thank you, first and foremost, for being here. You are a owner of a private chiropractic office with your husband, correct?
Correct.
And that is Harvest Chiropractic?
Yes.
And your locations are in...
Yeah, so we technically have two locations. We live in Springfield, which is, for people that don't know, basically at this point almost a suburb of Omaha. So we have a clinic there, and then in West Omaha, basically we have what I would say is our main clinic. So we both function out of both of those, seeing patients different days there. So yeah.
Okay. And is it just the two of you still in there?
Just the two of us. Yeah, I'm definitely more part-time than my husband, just because I want to stay home with my kids a couple days. Yeah, those are it.
Okay. And you have been a chiropractor for 9 years?
9 years, yes. I went to Palmer Chiropractic College in Davenport, Iowa, and that's where I met my husband. And we were both Nebraska people. So anyways, we ended up here, got married, and I mean, I could tell the story, eventually here. But yeah, we ended up coming in practice together, and yeah.
Yeah. And you have 2 kids.
2 kids, a 3.5-year-old and then an 18-month-old. They're almost exactly 2 years apart. And then we are expecting our third in July.
Yay! What's the due date?
I always just say mid-July because I actually have no idea.
You're like, I have no idea.
I know it's somewhere in the middle, but I don't know the date. So, and both of my other ones were late. So I just am like, sometime in July.
Yeah. All of my children are summer birthdays. The late July, early August is special for a pregnant woman in Nebraska.
This will be new for me because my other 2 were October. And so it had definitely, the temperatures were much mild then. So we'll see how this goes. Yeah. I'm not super excited. And the third time around, I'm like, oh man, yeah, I just feel heavier and a little bit more fatigue than the previous 2. So we'll see how this goes. But yeah, I think third and last. I think this is our bookend baby. So
you say that, but you never
know. I need to enjoy it. Yes, no, I feel like I'm pretty serious. We'll see. There are ways. There are permanent ways to make sure, for the most part, that doesn't happen. So we'll see.
There are. I just recently got my fallopian tubes taken out.
So you are
I
not...
don't believe those grow back. So.
No reproduction happening for Stacy.
No. But it's great. I mean, I was not super educated on that process. I mean, I still cycle. My cycles have been normal. Everything's been, normal in that regard. So, I'm grateful that was an option for me. That's for sure.
Right.
Because I guess now they take them out to potentially prevent ovarian cancer because, I guess they're finding that ovarian cancer is starting in the tubes and not necessarily in the ovary or something like that. So, but my biopsy came back fine. I'm fine. I just did it because I don't want any more babies, and I wanted to be in control of that.
Good.
Yeah. Let's chat a little bit about us. So I was thinking about this before our conversation today. I mean, it really started when I was pregnant with Beck, right? I mean, because I got pregnant, I had him in June of 2017, but I started, working with you and collaborating with you with what you were doing in, 2000, essentially, when I got pregnant around that time. We both were members of CrossFit Lincoln here in town, or here in Lincoln, I should say, and knew each other through that, and, knew each other through the grapevine, I think, in other ways too, professionally. I think that it's an interesting story, and maybe we back up a little bit and say, maybe we start with maybe what drew you to chiropractic, and then we can kind of go into our story a little bit. I think maybe that would make a little bit more sense. So why you grew up in small town Nebraska, correct? And what drew you to this career path? I mean, it's not maybe the traditional career path in regards to what you were exposed to, maybe in that area of the world. So,
I think I was like, probably, I want to do something medical. Feel like that was what I thought in high school. My mom was a nurse, but I didn't want to be a nurse, but I was like, I don't know. I think a lot of people are like, I'm going to be a doctor someday. So that was kind of what I thought. And then I think, I don't know, I remember what year of high school it was, that I had gone to a chiropractor myself. And it was very like, I mean, I maybe went 3 times total in high school, and it was all just like sports related. Like I had some back soreness. I wouldn't even probably call it that much of pain at the time, but I would go there. And so I had experience with a chiropractor. It was a good one. It's funny because I don't practice anything like him, but I mean, maybe that was my first exposure. And then I had a basketball coach in high school who went to high school with a chiropractor that practiced in Lincoln at the time, actually. So I think maybe he asked me, what are you wanting to do in college? And I kind of just threw out the doctor thing. And then he said something about chiropractic. And I was like, oh, yeah, I went to chiropractor once or twice. That was cool. And so he said, well, you should go shadow him. So I scheduled some shadowing, and this must have been, like my senior year that I shadowed him in Lincoln, and was like, oh, this is really cool. And just stayed in contact with him, and then ended up, I guess, basically taking a job there right after I graduated high school. So I graduated high school and then moved out to Lincoln and worked in his office just as like a front desk receptionist, and then kind of moved into their therapy room, which was a lot of like, it was very corrective chiropractic. So definitely not how I practice now. But so I would just help people get on like either like their corrective neck exercises or vibration plates or different things like that. And so I mean, I really fell in love with chiropractic working there. And I did that all the summers throughout college. And then basically somewhere in there was like, I think I'm going to go to chiropractic school. And so
what
I
was
feel
your
like really,
what would you get your bachelor's in?
like biology and chemistry. I mean, I think with that, I could have done pretty much anything. I could have probably applied to med school or whatever. But that's mostly what people were doing, or they were doing like exercise science or something like that. Hindsight, I wish I would have majored in like business and then done all my like biology classes, just because that's one thing in chiropractic school that they don't teach you, is that like when you get out, you are basically either, I mean, like, unless you work for somebody, you're a small business owner and you need to know how to run a business. And they don't teach you much of that stuff in school. Hindsight, I wish I would have done something more like that, but still.
Yeah. I mean, and Sway, obviously such an amazing resource for me, right? Like it's been incredible to be able to align with somebody that has those knowledge and that skill set for sure.
Yeah, we just rely pretty much on what to do. But that's humbling, but it's good.
Yeah. So then how did you decide on Palmer?
I visited that one and Cleveland and Kansas City. They're just the two close. I don't know. It sounds really corny, but I when I was visiting Palmer, it was kind of just one of those like, oh, I think this is where I should be, just touring the school. But I feel like, I'm sure Kansas City probably would have been really fun too. That's a fun city, more than Davenport, Iowa, I guess. But I think it's all about the people you meet. Like I made really good friends there, and like 3 of them practice in Omaha, so we see each other all the time. So it's good.
Yeah, and that's where you met your husband.
Yeah, I mean, so I guess I'm glad I went there. I met my husband, so that's cool.
That too. Okay, so you go to chiropractic school. In chiropractic school, I feel like it's obviously very all-encompassing in regards to a lot of different things that they would I would imagine they cover, because within the scope of chiropractic, like you said, like the way that you practice versus somebody else's practice, it is very different. And just like with doctors, just like with a lot of different professionals. Was there anything in chiropractic school specifically that stood out to you as an interest that like created maybe where you decided to go work after school? Was it in classes? Was it in your clinicals? What did that look like?
Yeah, so chiropractic college, I think they're the same anywhere you go. It's like they make sure you know the things you need to know to pass boards, and I think they make you like okay when you would come out of school. But I feel like if you don't get involved in like a club or do outside stuff, like it's going to be tough when you get out of school. So I don't even remember. It goes by trimesters. In chiropractic school, there's 10 trimesters over a span of 3.5 years. So I think somewhere in like second or third trimester, I joined a club called Motion Palpation. And I strictly joined it. I was like sort of interested in a guy. He ended up being my boyfriend for like a year. So I think that's why I joined. And a couple of my friends were in the club too. So it was more just like yeah, I'm going to do what these friends do. And I was interested in it. Or just, I think I wanted direction. And so motion palpation was really like, we learned how to motion palpate joints and how you're supposed to adjust. And then within motion palpation, there's a bunch of different chiropractors that were already in practice that taught different courses, such as DNS, which we can talk about, or a bunch of different methods. So it was really focused like ART, if people have heard of ART. So like not just the chiropractic adjusting side, but like how to work with muscles and how to rehab patients with exercise. And so I felt like there was like a little bit of a physical therapy crossover. I just felt like it was going to be a better way to treat a patient than just the adjustment part. Although in school, we focused mostly on the adjusting, and we did seminars on the weekends, and we would actually work on each other as students, adjust each other. I mean, it was painful at first. Like you're just so bad at it, and you practice on each other. But I'd rather do that than like just be learning how to adjust when I get into clinicals and be struggling on, somebody in the community. So by the time I got to clinicals, which is 6th trimester, I felt really confident adjusting. I was not scared to adjust people. I felt pretty confident. And yeah, so I feel like if you're a student and you don't join some sort of club that gets you on a path to learning that stuff outside of the classroom, you are behind. So.
Okay. Yeah. I mean, yeah, because it can take you anywhere, right? Like there's a lot of different types of practices out there in that regard. And chiropractic, I feel like, is a beautiful thing that you can practice different forms of manual therapy in different ways, and also be able, obviously, to manipulate this mind, which I find very cool and very fascinating as well. What led you to the demographic that you now serve, if you want to talk about that in regards to obviously within Harvest, but I mean, even before that, you had kind of like decided a specialty, if you will, of a certain population.
Yeah, and I didn't really get into that in school. Like I came out being, I would say, probably more of like a sports chiropractor. So with a lot of that therapy stuff that I talked about that I learned, which, yeah, like I said, is not stuff you're taught in school. So you do spend like a lot of money outside of the tuition you're already paying to learn that stuff, which really sucks. Yeah, I was, probably more a sports chiropractor. So I, out of school, joined a practice in Lincoln. And yeah, I would say it was a fairly sports chiropractic focused clinic. One of the owners went to CrossFit Lincoln, and they were all athletes from a college there. So it was all men. It was 3 guys, and they were all, did a lot of sports chiropractic. The reason I got that job was because I knew a doctor there, Dr. Tyler Ideas, who teaches for something called DNS that we can talk on. And so I don't know, he was kind of a mentor to me. So I was like, I would love to work with you guys. So I think my path I thought was going to be very like sports chiropractor. And I still like doing that stuff, but I think I got there and was realizing like I need to find something that is my own, because it was all these 3 guys doing the same thing. And I just felt like, I don't know, a sort of that imposter syndrome, like you're just not good enough to do this stuff. And at the time then I was just, realizing being a female, I was, attracting more female patients. And most of those patients were like, had kids or were having kids. It was just, and I was starting to get really interested in that stage of life, but I didn't have any kids at the time. So it was like, how do I learn about this stuff? Without just like having a baby. So I decided to take some doula training. So I took doula training strictly out of like, I just want to learn about birth. And then I didn't really know if I would take clients, but then I did. And I did that for a couple of years while also practicing, and learned a lot about birth and like I think I just wanted to understand like what women went through and then like why they were going to have, XYZ problem in pregnancy or postpartum. And then, yeah, just be able to relate to them on some level. And so, yeah, that inspired me. And then just kind of, found all these other things. Like, so you and me at the same time were there's a previous organization that we were both a part of that focused on like exercise specifically for women. They talked a lot about like your core and pelvic floor. And so then I was like, all this stuff where I was like, I don't know anything about this. And I also feel like, and I'm sure you can agree, because this would have been, 7 years ago now, that like at the time, nobody was really doing anything with this stuff. Like there are way more therapists and people that are doing stuff now. And it's way more common knowledge to talk about this stuff. But at the time I was like, wow, there's a really big need in the community for people to go to, moms to go to that are pregnant or have had babies or have pelvic floor problems or whatever age you are. And so, yeah, I was like, there's a gap and, I want to try to fill it the best way that I can. So I think that's kind of how it is.
Yeah. And it has obviously served you well personally and professionally moving forward.
Yeah.
It is, and I agree with you. Like at the time, those early years of all of this, it was not talked about in the way that it is now. And the amount of resources that are increasing is just, exciting to see. We still have a long way to go, I feel like, but we're getting there. So yeah, you and I, again, like we both were involved in CrossFit Lincoln, and you through that. When I got pregnant with Beckham, my third, I had actually reached out to Lauren Burrows, who will be on a future episode here, and had a discussion with her, like telling her that I wanted to do things different and I wanted to, experience this pregnancy different in comparison to my first two. I didn't really know if that meant like natural childbirth, but I definitely was like starting to toy with the idea. But I just, I was big into CrossFit. Like I enjoyed that stimulus. It was fun. It was exciting. I was getting so strong for the first time in my life. Like I was realizing what I was capable of physically, mentally, emotionally, and it was just this super empowering experience for me. But then I get pregnant and I was like, okay, so where is my right and what's appropriate here? What, and the usual doctor recommendation is like, just keep doing what you've been doing. Well, that I'm like, if you knew what I was doing, I don't know if you would say that. So yeah, I mean, I went and found that same organization that you were talking about, and followed their prenatal programming throughout my pregnancy. And it was absolutely like very empowering to feel like I was doing something, training for a purpose, training for an event, training for something. Having you as a resource at that time, I think you commented or something and we're like, hey, like, what are you doing?
Yeah.
Because I think I know what you're doing.
I remember this. I think we were both in the gym in that side room or whatever, and you were doing something. And I was like, I think we know the same thing, or like there's something happening here. Because I was like, and then you were sort of, we just both had found this stuff at the same time. And so then I was like, okay, I kind of want you to be my, I don't know, sort of a guinea pig. But then like you were also, you were more like, I guess, obviously interested in the fitness side of things. I'm coming from a clinical point of view and realizing like, while I thought the exercise part was really cool and I sort of taught a little bit of that for a while, I was just realizing, well, this isn't really, it doesn't make sense for me I should use my degree. I should like use the, do the chiropractic side of things and like do the therapies and all the stuff that I know how to do. And then like, somebody like you and like dive into the fitness and anyways.
Yeah, that's true. We're like side-eyeing each other like, oh, do you know what I know? Like, what is this?
I know.
And then I think you were like finishing your doula training about the time that Beck was born, I want to say.
Yeah. You had another doula there and I just like, I guess kind of shouted her just to see kind of how she does things. And also, good first exposure. It was awesome. I mean, I'm sure you can speak to that birth on your own, but it was like empowering, I think. Probably maybe redemptive in some ways. But I was like, oh, this is so cool. Like, this is, nuts. I mean,
Was
It was
that
well
your
done.
first experience watching like a natural childbirth?
I think so, and then I had a couple others that were natural. I had just, like it was really nice. I got to see, like, a cesarean. I got to see, people that got epidurals. I got to see, natural childbirth and all this stuff. So you get exposed to, like, every route that people can take. Yeah, I mean, natural childbirth is wild, for sure. It's
Mhm.
definitely different, but I it's different for everybody. It's like some people some women are very loud during childbirth. Some are, like, very quiet, and it's all over the place, but really, really cool.
Yeah.
Yeah.
I think I remember apologizing in the text message
Yeah.
afterwards in some capacity.
Yeah, I know. It's crazy.
Um, yeah, I guess I didn't realize that was probably your first like experience. I mean, it was my first experience too. My first like but yeah, I mean, so Tracey knows me very well.
Yeah. I have seen you all. It's
Seen the
imagine.
most intimate parts of me, that's for sure.
I know it's always my female patients that, like, I'm, like, gonna go cup or something, and I'm like, "Do you mind if I pull your, like, pants down here a little bit?" And they're like, "I don't care." It's like, you see, whatever. Once you have kids, like, you just don't care anymore. There's just no shame. I'm like, yeah." Like, every mom is the same. They're all the same.
Yep. Yep. It's in a safe space. Like you create a safe space for those women. So therefore,
Yes.
like it's very easy for us to be like, okay, that's fine.
Mhm.
So yeah, you were at my birth. And I believe like after that, I mean, I started seeing you took me through their postpartum program afterwards.
Yeah.
And I'll never forget, they were having a coach seminar coming up, and I had messaged you about it or something about like, hey, like I think I really want to do this. Like I think I do want to like get involved because you were like the local leader at the time of our area. And you told me you were like, well, you can just have mine. Like I'm not gonna be able to go, or I'm not going. You can just have my spot. And I just remember like being in the car and I just like started bawling because it was already sold out. I was like
Mhm.
just so excited to be able to go. And I went to that training. I was like, I think 10 weeks postpartum at the time when I was there, which was great because, everybody else around me was also like having babies. But I mean, in that experience and the knowledge that I learned through that organization, I definitely like 100% appreciate and have gained a lot of value from that. Moving forward, like I remember, becoming a coach for them. So essentially, like under you kind of directed the area at the time. Just coming and watching you practice and coming and watching you host these series and host, all of these things and watching the way that you saw movement really like impacted me, I think, as a coach moving forward. Like the way that you see movement, I think, is so unique and so rare. And you have such a gift for that of like troubleshooting movement in any capacity, but also, under a fitness umbrella. Like that's very important, I feel like. And I definitely have still used so many of the things that you have taught me, watching you and with that guidance. But there's a question I have for you that I don't know if I've ever asked you this. So I'm just going to ask it right now because why not?
Mhm.
Why me? Like, why? I mean, I didn't really have any certifications, right? Like, I mean, I since have gotten a lot and I've learned a lot and I've, proven that I know what I'm talking about for the most part anyway. But yeah, like, why me?
Yeah, and it's you were kind of talking about like having an eye for movement and stuff like that. I would say because my husband has always toyed around the idea of like we should have, we could hire somebody to do exercise or do exercises for patients or stuff like that. And I am always really resistant. And I think it's because I'm really picky.
Mhm.
I think we could have somebody that would do some of the basic stuff, but I think when it comes to like looking at pelvic floor type stuff for women's like core abdomen stuff. So something like a diastasis or managing pressure with breathing and all of that stuff. I feel like it does take a little bit of, I mean, either somebody that's really well trained or somebody that has just a little bit of an eye for movement. And so I think I knew that you moved really well. Like I think I knew that you understood that. And So I think that was one thing. Also, you're pretty outgoing. You talk to people like easily. So that, I mean, that's obviously beneficial for anybody that's going to be like selling themselves on what they're doing. But yeah, I think it was mostly like I felt like if I said go see Stacy, that I would trust that you were teaching the things correctly, or you could at least see something and, be able to be like, okay, hey, you should go see Tracey for that. You should go see whoever for that. And yeah, it was, you were recognizing that stuff where, yeah. So that was probably your uniqueness in that way. But yeah, I'm very picky on stuff like that. So you should be honored.
I am actually very, I knew that about you. I mean, we've had lots of conversations around that. So I still am very humbled and very honored. Still to this day. Yes, VICTRESS came about after, Stassi became a client of mine and started to encourage me to get my own space and do my own thing. And I think at the time you had stepped away from the organization that we were talking about. I had kind of taken over that top tier situation and was still very involved in the referral process to you and making sure that is something that VICTRESS will forever stand very strong on, is that knowing when to refer and being okay and not trying to just troubleshoot things, having such an ego that we overstep our lanes in regards to fitness profession. That is something that I have held very, very strongly since day one. And finding the right professionals is obviously a huge challenge, but also huge opportunity in that, to make sure that we're making sure that we're finding professionals that are serving our demographic well. And obviously you are one of those that have continued to do that. So VICTRESS opens and you eventually decide to join us in a way, right?
Yeah, yeah, like I said, I worked for a group practice with those 3 other guys. And then at the time, yeah, I kind of always knew I was going to practice with my husband, but it was just like, when's the right time? And so for some reason, we chose April 2020 to be the right time. We chose that, I think, in December of the previous year. And it was basically, once we found a space in Springfield where we lived, it was like, we're going to put an office there because, Springfield's a town of 1,500. There's not a lot of office space that comes about. So it was like, once we found it, I had told my bosses, I'm going to leave. And I was very transparent with them when I was hired that at the time, my husband was just my boyfriend, so maybe they didn't take it that seriously, but I was like, I'm going to probably practice with him someday, just so you know. So this is more of a stepping stone. So you guys had approached me, I think, when I was still at that clinic to be a part of VICTRESS, and it was going to be, basically conflict of interest with, I couldn't practice there at both places under my contract. So yeah, once I was like, I'm not going to work here anymore, I didn't feel like I was ready to just go to Springfield and Omaha and then leave all my Lincoln patients, because I had built up at that point a good bunch of clients that I felt like I was seeing regularly. And so I was like, I think I just reached out to you guys again and was like, can I use this room? And so, I saw patients out of there, a very similar schedule that I was doing while I was at the other office, but yeah, and I don't remember. Yeah, at that time, I would have been living in Springfield, so I was commuting. Yeah, which is about an hour, and that gets old pretty quick. So I was starting to taper down my schedule, and then at this time in 2020, I got pregnant with my first kid. That was also one of those things. Once a kid came, then I dropped a day. Then the next kid came in 2022 or whatever. Yeah, so it was just kind of every time I was kind of realizing I want to be able to spend time with my kids and not spend, 2 hours on the road every day. So I was just kind of tapering down my schedule to, just fit what I wanted and then start seeing patients here in Omaha. So it was a gradual transition, but something I knew eventually that I wanted to practice full time close to home to be close to my kids. And, but yeah, it was being in that space was, it was really I think the ideal scenario for somebody that treats primarily that population. Hey, we have this person literally over here. If, somebody's in the gym that's having a problem, go see them. Or, there's at the time, Bethany, who works for you, an OT that can see you for this or whatever. So it was such a yeah, I think your goal was kind of like a one-stop shop. We've got like all these people here that can help you and a wealth of knowledge. And so it was just perfect. I was seeing my patients, also like seeing a lot of the people from the gym. I knew what programming you guys were doing. It, yeah, there wasn't a lot of like wondering what's going on. So, and I could be like, hey, Stacy, I'm seeing so and so next time in the gym, maybe have them squat to a box instead or whatever it is. So it was really cool. I mean, it was really the ideal scenario, I think, for women training, especially, around pregnancy and postpartum and all the stuff that comes with that. So
Yeah, I mean, it is invaluable. As a fitness professional, I know my lanes and I know my scope of practice, and I know how to like lean on the resources and value the resources of people that are doing what you're doing and able to serve the women better. I mean, it's supposed to be a collective effort here. It's not supposed to just be, yes, a one-stop shop, but the goal is that it's all just under one roof. It's not like I know it all.
yes.
And yeah, I mean, that was definitely like full circle. Like having you in the space with us was just definitely a very like full circle, like surreal moment for me. That's for sure. And still to this day, like it's just, I know I am the trainer I am, and I know, the success that we've been able to have, like started with you, like truly, like you gave me a shot, you believed in me, and I was able to hopefully make you proud and to return the favor as much as possible. That's for sure. I know, you're involved fairly a decent amount in the Elkhorn location up in Omaha now, from a workshop perspective and hopefully beyond too.
Yeah. It's tough because Springfield and Elkhorn are up there about 30 minutes away. So
And
I don't get to make it out there very often. Yeah, I teach a workshop with another pelvic floor therapist that I refer to a ton here in Omaha. And it's been good. It's just like, yeah, getting to educate women on stuff like the core and the pelvic floor and ways to, change up their lifting if they're having problems, when to see somebody for whatever they have going on. And yeah, this PT and I aligned really similarly on how we see treatment, and we both are very pro weightlifting, and I mean pretty much like I truly believe if most people are weightlifting regularly, like they're going to have way less problems than if they're not. And so, yeah, anyways, it's just, it's been good to teach those people, and everybody's really, really interested in the content. And it's good if they connected that way. I feel like at this stage in my life, um, I work out mostly in my garage because of the time factor. I work out over lunch. And so I would love to be able to make it out there more, but I don't. But I just follow the stuff that you send me to do. You just tell me what to do, and I just follow that. So
which
I
is so
feel good.
surreal. So
I know.
surreal.
Stacy, I'm pregnant again.
Just like a
It's funny
full
because
circle.
probably figure it out, but I like don't want to figure it out. I just want somebody to tell me what to do. It's on this, it's on this program. I go and I just do it. So, yeah, it's been good. Obviously, I trust you. I think you know what you're doing, programming wise, and yeah, I mean, we've both been exposed to really similar stuff, like in our training. We didn't really mention or talk about the DNS thing, but I mentioned it a couple times before. You've done some training with them. I've done quite a bit of courses with DNS. It stands for Dynamic Neuromuscular Stabilization. It's out of Prague. And it originated basically, they observed baby development from birth to roughly a year, basically until they start walking, and observed just normal movement patterns in babies. And then alternate movement patterns. If a baby has some sort of neurological condition, what do you see there? But you can look at the baby and they show you basically the perfect balance of core stability and breathing. I mean, if anybody's ever had a baby and they've seen their baby breathe, it's perfect. They use their abdomen and all those muscles perfectly. They're not chest breathing. They're just really balanced. So we can use those developmental positions to train adults. It's almost like rewiring the brain. So it's like if you have a problem, stabilizing your core, in a squat or something like that, and you have pain, we can kind of look at the core and go back to like a developmental pattern. Like like lifting your legs for the first time up when a baby can figure out how to do that, and then use that position to retrain the brain basically. And so that stuff is like the foundation of kind of how I treat patients, especially if they have core conditions, pelvic floor conditions, and kind of stuff that you've implemented with your clients in the gym. Yeah, how you like prep for movement, how you, yeah, if they've got any like diastasis or anything, like really it's an all encompassing, I guess, therapy approach. And it's been the foundation, I think, for me in clinic, and I think a big part of VICTRESS too.
Yeah, I mean, it absolutely has. I think that, we talked about this stuff not being talked about a ton, as we were like getting into like specifically, obviously, like women's health stuff, but the way that DNS articulates and teaches and describes core and ways to activate your core and the ways to stabilize your core is just so I think all encompassing, and when I articulate it or talk about it in the gym with clients, it's, we're just opening up file cabinets of your development and, getting you to like introduce yourself to the developmental patterns that should be there, may not have been there for whatever reason within the developmental process, but should be there. And now we're going to like teach you like those innate movement patterns that you already know how to do. We're just going to re-emulate those and use it in regards to, in our space for sure, like core stabilization and, utilizing how to start with the core and focus on the core before we start to get to the rest of the body, right? Like in being able to set the foundation and progressive overload the core in ways before we're progressive overloading the rest of the body. At least in theory anyway, right? Like getting people to buy into that at times is still a struggle. Even in, the gym, you get going, you get fast, you get like moving into your movement patterns. And it's something that like, I think it's not thrown by the wayside, but I think that if the member isn't consistently reminded and or bought into what it can do for you, it isn't prioritized. So what are you telling patients? What are you telling people that you're working with in regards to the importance of, stabilizing your core with a appropriate intra-abdominal pressure, whatever it may be? And maybe I should explain what that is, but you can explain that.
Yeah, sure. And like you mentioned it before, just like starting with the core before you go like outside the body. Like I always give the example of like literally to move my arm like this, there's a core contraction that happens. You might not feel it, but it does happen. And so yeah, you just like, it is the foundation of literally every movement. I mean, it's the foundation for breathing. And so I usually, just approach it as like, we want this to be stable. And, stability, what does that even mean? Basically, we want intra-abdominal pressure. It's like 360 degrees around. So our core, we want breath to be happening all the way around. A lot of people, when I'm like, okay, let's work on our, I guess I don't usually try to lead with the term belly breathing, but most people view that as belly breathing. And so then it's just kind of like sticking out your stomach. And then they're not breathing out into their side. They're not breathing out into their back. And I would argue that's probably even more important. From a chiropractic perspective, I mean, low back pain is the most common thing that we treat. And so like getting adequate breath and pressure protects your spine, protects your discs. And so that's huge if you're going to be doing anything really. But, especially if you're going to be lifting, having that adequate pressure against your spine. So you're not, using the little tiny muscles in your back to make movement happen. You're using your core and you're using your glutes and you're using big muscles that are meant to do that job. Really, yeah. And then when it comes to pregnancy and postpartum, the biggest thing that women struggle with there, besides low back pain, is, that separation that happens in their abdomen. And everybody's really concerned about it. I mean, it happens to every pregnant woman. So it's not, you're not going to ever avoid it. But you can do things to hopefully not make it be this huge gap postpartum. And I was just thinking about this before we did this podcast too, that, like weightlifting and training for birth, yes, like it is important. It doesn't guarantee that you're going to have this like stellar birth with like no problems, or you can do, doesn't guarantee natural childbirth if that's what you want. What I do think it does guarantee is a much better recovery on the other side. I think, because you have to take the 6 weeks off or whatever you're doing. And during that time you lose muscle, you're not really doing a whole lot, maybe except for walking and some like mild movement. It just builds a better foundation on the other side. And so, I always like encourage women to at least do some form of like resistance training. And it can be body weight squats. It can be, some core stuff that I show them, like those DNS positions or stuff like that, but something that's going to build a good foundation. So, we're protecting things like the abdominal wall and the pelvic floor, because pregnancy is one of the biggest stresses on that is a lot of extra weight on your pelvic floor. And then obviously the belly, groin, and diastasis. Something like diastasis is really just, if it's lingering and it's not getting better, it just tells me there's a lack of stability there. So we just have to retrain the brain to use the right muscles in the core, not overuse some. And so, yeah, that's kind of where I think it takes a little bit of the pickiness with like seeing stuff. And I've always been hesitant to like do virtual stuff with people, because I'm like, I feel like I need to touch you. I need to feel like, okay, are you activating here? It's so hard to just put together like stuff like that and expect things to be done correctly. So that's where it comes with the, I refer to people. I always encourage people to at least like, let me just like see and give you some guidance. And so that was a really roundabout way to answer whatever.
It's perfect. I think that there's the core dynamic, starting with the core before we're again getting into the rest of the body. Like it is unique, I think, in a lot of ways. A lot of programmers will like put core at the end of the workouts versus like intentionally focusing on that either in the warm up or at the beginning of the workout, like that being the priority versus not. Because by the time we get to the end, like the fatigue has set in, and now are there pressure leaks? Like now are we, dealing with the fatigue of the entire workout, and you're not able to give the core like that intentional breath or stability that it's needing to complete the exercises appropriately and safely and beneficially, I think is probably the biggest thing, right? Like, VICTRESS has taken the mentality, and probably thanks to me, but also thanks to you. It's like a once removed, like we do not do sit-ups, right? Like that is not something that we program within our gym. And I think fitness in general is like getting around that to a certain extent. I think that realizing like the sit-up could be more of a sports performance or an athletic performance movement versus a core movement.
Yeah, and on the sit-up, I will say that movement can be done correctly and you can get benefit from it. But like 99% of the time, it's not done correctly. It's more of like it's a lower back exercise. People get low back pain after doing sit-ups. So it's just one of those things where it's like, yeah, let's just not, there's better ways, right?
Well, and I would argue even the plank. How many solid quality plank holds, do we see?
Right. Like, yeah, not very many. And yeah, it's a really tough one. I mean, like it doesn't look that hard because you're just in one spot, but it does take, we're talking about core stability and strength. It takes a ton of both of those to not have energy leaks elsewhere, like into the low back or where, the upper body, even because you have to hold yourself up. So yeah, those are challenging exercises for people for sure.
So if you're a practitioner, you are a practitioner. So if you have a patient that is, coming to you, whether it's in a postpartum time period of life or, menopause is probably something you're seeing more and more right now, especially with, like you said, low back, pelvic floor, like all that type of stuff. Like that stage of life can kind of exacerbate some of those things from what we know. Or just any stage of life. And I'm a woman walking into your space and asking you as a professional, like, what's your recommendations for them now? I mean, you don't have a Victress necessarily near you or whatever it may be, but in regards to what are the best ways for continuing my treatment with you, but then outside of that, what should I be doing? What should I be focusing on?
Yeah, and I will say VICTRESS is not too far from this office, so that's a pretty easy referral. Yeah, I usually give patients, and I've been really trying hard to give them like 2 exercises in a visit that they can do. And then we can go, we can up it or we can do something like that. But if we're rehabbing something, I'm giving them 2 things, and it's almost always like a stability type thing. And typically it's some sort of like breathing in whatever position we're doing. And then maybe like a stretch. If they're like looking for programming, then yes, I would like guide them to a gym space. Or I don't know, it's so hard because so many people have different backgrounds with that kind of stuff. And, if somebody like the menopause stage, like I just think of, yeah, that 50 to 60 range, and maybe they've never lifted weights before. Their exercise has been basically walking. Those people need like a really dialed back resistance training program that just focuses on, I think, still weightlifting. And as heavy as they want it to be. But those people, yeah, just need to focus on like getting stronger. I mean, everybody does, but like I think, yeah, just something. I think that the research shows like if you do 2 days of consistent resistance training, then you can build and maintain muscle, which is like 2 days a week is not very much in the grand scheme of things. So yeah, I'm encouraging them to find, if it's a place like VICTRESS or somebody that can program. I just don't have time to program for them. So I can give them some rough guidance. But yeah, generally speaking, from the principles of the things I would teach in my clinic, it would be just, a ton of the breathing stuff. And based on their, somebody that's pregnant or postpartum could be dealing with pelvic floor tension, and somebody that's like 60 years old going through menopause or something could be dealing with more like some weakness or just lack of strength, or maybe they have like completely lost touch with how to activate their glutes or whatever. It's another, like, you have to kind of touch and see what they're lacking. If it's strength or if it's stability, it's usually a combination of both.
I think, speaking on menopause, I think that we're going to see some big changes in regards to, number one, I think it's buzzing in the world right now. Menopause in general, like there's some big names out there starting to talk about it. And, Mel Robbins, I think, has had it on her podcast like multiple times now, experts on there. And what VICTRESS has now taken the mindset of like, this is a programming that we are offering like 3 days a week. Like this is like a group class version of what we're offering, because we do feel like it's so important in regards to like being able to train intentionally. What we're up against is, just like you said, like the demographic that's in menopause right now is, or in perimenopause and menopause probably not super familiar with weightlifting. Like they have either been runners or they're, walking. Maybe they've really never exercised in their life. They're functioning from definitely like a very innate societal programming of less is more in regards to calories and move more and all of those things. And so a lot of our demographic right now it feels like almost like an intro to weightlifting, whereas the research shows the programming should be very, very hard, very challenging, very heavy, at least as heavy, whatever that is to that person, with some sprint interval training or some plyometric training. Well, we have not served these women in this age demographic in a way that they're, that it's appropriate to get into that stimulus, walking into the gym day one. So, we have been creative in regards to like how we're programming that right now and how we're scaling that. I still program like I should, but then as coaches, it's our responsibility to scale from there. But what I find interesting is, our demographic, right? Like how old am I? I'm almost 37. As I age and as I'm getting older, having that foundation of strength training already, having the ability and having the wherewithal of my core and my pelvic floor, and having, the knowledge in regards to like what progressive overload is and what's heavy for me. I know my RPEs. I know my rate of perceived exertion. I know what that feels like. And so as I start to age, like what does those symptoms look like for me? Like does it change? Do I deal with the same issues in the same ways? I think the training still needs to change and the prioritization of recovery still needs to change. But I truly feel like there's going to be, we're going to see this shift in regards to like how to serve them best. And it's unfortunate that we haven't been able to serve women better up to this point, like, and the ones experiencing right now. I mean, obviously, like, absolutely, it's still better to come in and join the gym and start training in whatever capacity that you can. Yeah, we're having a lot of conversations around menopause right now because I think it has such a negative energy and a negative connotation. And we're really trying hard to like reframe that. Like we've even talked about like naming it something different in regards to programming.
Yeah.
Like, why not? Why do we want to name it something different when it is what it is? And why don't we just like take that power back and realize like this is a powerful, empowering opportunity versus trying to like run away from it?
Yeah, and you were kind of like speculating is it going to be different for me, like, because of this foundation I set up? I mean, I think like 100% it will be massively different for people like us who are going, will go through those stages. And my husband always, like, I will, bitch about something that I see, like, oh, this, like, they're telling people to eat low fat and, all this stuff. And like, or, if I'm like, a patient's doing this and he's like, Tracey, you have to understand, you know more than they do. And it's like, and I just have to always remind myself, like, that group, for instance, grew up, in like with the big low fat boom, of like eating pretty much like probably less than 1,000 calories. That's what you had to do. And either like, you don't lift weights. If you're exercising, you're doing just a ton of like extensive amount of cardio, I guess. And like I guess what was the jazzercise? I don't know if it was jazzercise, but I don't know, just a ton of like no weightlifting, but just a ton of like over cardio. Make sure you're sweating a lot. Classes, of course, you could sweat plenty weightlifting. But like, I don't think you probably program with the goal of like, I'm going to make sure everybody's on the floor dying after this workout. Like, that's how we know we had a good workout. Because especially in menopause, like that is not, that shouldn't be the end goal of anybody's workout, especially at that stage. You should hopefully feel energized and like you want to come back and do that again in a couple of days. And so I think that's just, that is the shift that needs to happen, is like, that, you need to eat adequate protein for your body weight. Just some of the basics, like eat adequate protein, drink water, lift weight. Of course you could do some cardio, but like, I mean, I don't even know, what is the research now? It's like 150 minutes a week of like zone 2, which can be like a really fast walk. Like it doesn't have to be wreck yourself on the elliptical for an hour, this really intense HIIT class that you're on the floor basically puking at the end of it. And I think that's how a lot of people think fitness is, and they're like, I don't want to do that. Or, especially if it's menopause, they're like, I don't want to do that. I can't do that stuff. And I mean, I've seen you guys, teach that age range, in group classes and stuff. And it's like, we should be focusing on just like, weight training and keeping them muscled. I think it was Gabrielle Lyon that was kind of talking about, I don't think it's an obesity crisis that we have. It's like an under muscle crisis that we're dealing with. And it's like, we need to build and maintain muscle for our whole lives. And it doesn't have to look like 7 days a week you're killing yourself in the gym, 2 to 3 days or whatever, that you can do. And it's, I mean, I've seen some of the stuff that you guys program, and I think we should focus on like basic and pretty basic stuff, even just like the ability to get up and out of a chair. Like there's some people that can't even do that. And so that's where you start training. I mean, that's, if I've had older patients in here that can't do that, like maybe that's an exercise I send them home with, just building strength, sitting down and standing up. And I think we take that for granted. Like, I don't ever think about that. Like, I can do that just fine. But there's some people that that's the hardest part of their day, is getting up. It's where I just think there is definitely a shift. And hopefully this next generation is, I mean, a good chunk of us are understanding that. that that's really important. Yeah. And just, I think how many years ago you wouldn't find very many women, in a squat rack. But like if you go to, a regular gym now, I think you see it a lot more, not people aren't always just striving to be skinny. I think we're realizing like, you can look great also just being strong and lifting. I promise you, if you go lift weights, you're not going to turn into a bodybuilder. It doesn't just work out that way.
Unfortunately, it doesn't work that way.
Right. But yeah, you're not going to get huge. So anyways, yeah, I think finding the right programming that's also not overdoing it too. That's always been, I think, my one. I did CrossFit, same as you for like how many years. And that was always, I think, my big thing was like, man, those workouts were designed to like rush you. And while I loved it at the time, I think whatever program it is, that can't always be right for everybody, like that can be right for this 23-year-old man who doesn't have hormone problems. But like maybe for me, that actually makes me feel really inflamed and, whatever. So, I mean, that could be any program. But yeah, well, I think that just takes more people programming correctly for that stage of life and seeing things. So it's not a one size fits all, I guess, is what I'm trying to say.
Yeah, no. And I think from a programming perspective, like I always say, like the best workout that you can ever do, whether it's, you hear like HIIT or cardio or zone 2 or boot camp or whatever it is, strength training, like whatever you choose, whatever it is for you that you enjoy, number one, that you're going to stick with, number two, but also like, are you able to recover from it? Because it does not matter what we do as programmers. If you are not recovering from it, you're not going to see the changes and the adaptation that you're wanting and or desiring or that benefit you. So what recovery looks like for women in different stages of life is so different. And that's what it comes down to. It's not necessarily that we need to like be changing things up and doing things completely differently than men. It's that our recovery abilities shift and they change. And that's what this all comes down to. That's what VICTRESS is. And that's what VICTRESS is all about is, there are times when we're in strength cycle where I get feedback that these women are bored and they're over it and they don't want to keep doing this, right? Because they aren't getting those endorphin dumps the way that, a boot camp or something along those lines might get them. And, from a sales perspective, I could just like up the intensity and make it harder and get the buy-in, higher. But I'm also not going to do that. I'm not going to like discount what I know and what I know will serve them best in the long run. And if you are choosing to be a part of this gym, like you're choosing and you're buying into the mission and the knowledge behind the mission and, staying the course as much as I can anyway, is ultimately like who we are, and we know who we are and we're going to stay that way. And it's, being able to know for a fact that we're able to serve all demographics of a woman's life or stages of a woman's life in a way that is appropriate, is imperative, but also knowing that I have referrals like yourself, like Bethany, like Amanda, Rachel, like all of these women professionals. They just all happen to be women. Tyler is also fantastic, but that I can refer to back up and help support what I can't see, what I can't change within the gym. It's better together. And I think that the importance of like having programmers in gyms aligning with professionals like yourself to serve women is imperative to the success and the service of women moving forward.
Yeah, I agree. And I think personal experience goes into this too a little bit. Like you've had multiple babies in, different stages of your life in different ways. Like I think you were more of a runner when you had your first couple, and then
I didn't even work out at all.
Okay, so you didn't work out, and then you did run for a while.
Mm-hmm. Yeah, and then I became a runner.
Yeah, and then you got more into strength training and just. Yeah. I mean, I think your own personal experience, you can be like, okay, these were, massively different. I mean, and you can even tell, like, with your body composition, the way you look, it's definitely, you look strong. And same with myself. Like, I have strength trained through these whole pregnancies, but I've also, like you talked about, being able to recover. Like, I have way more on my plate with having 2 kids and being pregnant than the first time. Like, the first time I was like, I have all the time in the world and I can nap whenever I want. And I think I did programming that you programmed for me maybe 5 days a week. And now I'm roughly doing like 2 to 3 days. And some days, I mean, I just know like my body's like, ooh, not today. Maybe I just need to do like a walk or something. And so, yeah, I think personal experience goes into that too, like meeting people where they're at, like what's realistic for you, taking in all the other factors of like, yeah, how much you're eating, how much you're sleeping. Yeah, what's your work life like? And maybe you can only fit in a 30-minute workout, but you can do the 3 most effective movements that are going to be the best for you. So yeah, I mean, I think that stuff is invaluable for people. And it does come at a cost. It comes at a cost to see me. It comes at a cost to go to your gym, or see any professional. But I always tell people, like, I think you should spend money on something like this than buy an extra cute something for your nursery, because it's an investment in your future and your health. That thing in, that really cool wall in your nursery is going to give you like satisfaction for a little bit, and you're never really going to think about it. Yeah, I always just get help when you need help, and yeah, find the right providers that know what they're talking about. And when you find somebody that you really vibe with, usually they know the people, like, obviously you guys have multiple providers under your roof. I've got like, the network of people around my area that I'd be like, go see this person. Or if I know they're in Lincoln, go see this person. And that is awesome.
Yeah. Yeah. Well, in closing, the last question here, if, I don't want to say if, when you are speaking to a woman, and you have had all the different experiences of life up to this point in regards to pregnancy, postpartum, just being an athlete, and I know you were an athlete for a long time, well, still an athlete, let's be honest, but it's just pregnant. What is one thing that you wish more women knew? Like one myth, one thing that if you were speaking to a woman, if you wanted her to know one thing that you have learned in your years of being a practitioner, or just in your own personal experience, what's one thing that you would give her?
Yeah, I think the most passionate thing that I can think of for me is like that you need to eat more. And I went through high school, like towards the end of my high school, I was borderline. I mean, I had somewhat of an eating disorder, I think. I think everybody's got some disordered eating at some point, usually. But I ate very little, and I was playing multiple sports. And I don't even know how I was functioning. But you're a kid and things are different. I think I would encourage those young kids to eat and focus on protein, because it is something that I just didn't do for so many years, and it's still hard for me to do, even though I know it. It's hard to get all that in. I mean, when you feel like total crap in pregnancy and like every bit of meat sounds disgusting, it's hard to get protein in. But I've realized how it helps literally everything. So that would probably be what I would tell women, is to just eat and focus on your protein intake. Obviously focus on quality foods. And I'm not going to dive into the specifics there, but yeah, I think that's going to be even more challenging with technology and social media and just the pressures of what you see online. But that would be what I would give somebody for the future.
Yeah. I love that. It's funny you say that. Nicole Legler is our head coach in Lincoln now, and she's a registered dietitian, and she's going to be coming on here in a few weeks. And I asked her today, like, what's the one thing that you were super passionate about that you want to talk about? And she said low energy availability. So stay tuned for that episode to follow up the answer there.
Seriously. Yeah. It's just, I know the amount, like sometimes when I talk to patients about protein and I ask them about their intake, and if they have, if they kind of lay out what they eat for a day, I'm always like, how are these people functioning? And yeah, I'm so interested to hear Nicole. I mean, Nicole's got tons of knowledge on that stuff, but yeah, that is one thing. And I talked about the under muscled thing. Strength training and eating adequate protein will set you up so much success in your future. And it's like, I'm really hoping it's changing with this, our generation being more aware and I was just talking to another chiropractic friend of mine, and we were just talking about how we're building a really strong foundation, I think, for our kids. Um, they're going to know what it's like to have parents or that regularly exercise, that eat fairly well and provide healthy foods. It's not going to be abnormal for them to be doing that stuff. And I think that's huge. And I'm hoping that that's going to help change the next generation of kids too. Because we have a problem obviously with that. But anyways,
Yeah. No, it's so true. So true. I 100% agree. Well, thank you. I'm going to be respectful of your time. Thank you for doing this and thank you for coming on.
thank you.
And I hope that you will do it again and we can dive into all other topics because we didn't even hit on birth and more into depth. I would love to just have like a whole episode on like prenatal exercise with you. I think that would just be like so fun from a physiological perspective and an exercise stimulus and all those things. So if you were down for that, I would love to do that in the future. But thank you for your time and your knowledge and the opportunity you gave me once upon a time. I truly, truly appreciate you and what you're doing. And I always, always, always sing your praises everywhere to everyone. And I hope that you continue to do amazing things and grow your family as big as you want it to be.
I think we're going to be done with 3, but yeah, thank you. Thanks for having me on. Yeah, I'd love to come back on and talk about some other stuff. But yeah, in closing, I'm really proud of you and what you've built with VICTRESS. I mean, I think I couldn't even have imagined that it would be what it is now. And that's so awesome. And your team's so good. And really the vision that you had from the start is like basically what's manifesting, which is so cool. And I'm happy to have been a part of it and still be a part of it. So thank you.
Yes, yes, absolutely, Tracey. Well, thank you, and we will talk soon.
All right. See you later.
Bye.